welcome everyone to the topic with Healthwatch Enfield and Age UK, along with Public Health, the Enfield Directorate of the NCL Clinical Commissioning Group, and Hetal Shah, who's leading on the flu vaccine programme for Enfield. I will get introductions shortly, but I just wanted to say my name is Fazila Ahmed. Welcome to everyone. We're really keen and pleased to have this and host this topic. We've been having a number of members of the public asking us lots and lots of questions around flu, and I know Age UK have had the same, hence us putting this together. So without further ado, can I introduce Dudu, if you can say hello.
Hello everyone, my name's Dudu Sher Arami. I'm a consultant in public health and I work in the public health team at the London Borough of Enfield.
Thank you. And Riyadh?
Oh, hi, I'm Riyadh Karim. I'm Interim Head of Primary Care Commissioning at the Enfield Directorate of North Central London CCG. Delighted to be here.
Brilliant. And Alison, I think you're going to be co-hosting.
Hi everybody, I'm Alison Gordon. I'm Head of Prevention Services at Age UK Enfield.
Hi, welcome, thanks. And Hetal?
Hello everybody, I'm Hetal Sharma, GP in Enfield, and I'm leading on the integrated care system on behalf of the Enfield Directorate of NCL CCG, and I'm pleased to be here.
Great, thank you. Yourself, so the listeners can know who you are, because you'll be showing the video.
Yeah, my name's Bea Scott, and I'm the Head of Communications and Engagement for the CCG.
So welcome.
Thank you.
And what we'll do is I'll make sure that you can share your video, so I'm making you co-host. So without further ado, lots of people have been asking us about the flu vaccine. We know with COVID there's lots of concern around, so it's really important to really understand from a patient perspective, local resident perspective, what's happening. So we've also been looking at putting together flu surveys so we can check and really understand from all of you what your concerns are and what information you need. So hence we've put this call together. So hopefully we'll go through the questions one by one and get some responses. But what we'll do beforehand is we will hear from Age UK, they can introduce themselves, but also from Public Health. Dudu will just give you an update about the flu programme. And then we're hoping, technical issues permitting, I can see V shaking her head, we'll hopefully share a video with you. If we can't do that, we will just make sure that that gets around to everyone once it's live, and one of the team can just give an update verbally. Hopefully that's okay. So Alison, did you want to just say a couple of words around Age UK and the things that you're doing with flu?
Hi everybody, just to update you, as everybody knows, it's a very difficult time, and we've just been very gently releasing our services and activities for people to get people back to some of our group activities and in-person activities. And it feels very much like we're doing a bit of a cha-cha-cha. It's 2 steps to the side, it's 2 steps forward and 2 steps back all the time, and a huge amount of planning is going to make sure everyone's safe. And so what we really want to sort of, remind people is to make sure that if they're called for a flu jab, to have one, and to actively encourage everybody to go forward and do that this year, so that if they are attending any of our in-person groups or just anything, that they're more protected and well protected. So just to sort of like reinforcement to all the other messages you're going to hear today, if it's available to you, then take it. It's that kind of reminder. And if you've got any questions, again, come back and ask anything to the professionals that are here present. So that's the key message I think we're saying. We're actively encouraging everybody to have a flu jab if possible. In terms of our service delivery, we are very gently creeping back to having day services opening. Our home care services have been running, and we're slowly thinking about introducing back our tea and chatter sessions, falls prevention and our memory clubs. Our Fit for Life programs have returned, so we've got walks and we've got exercise classes, which is so important. A number of people have told us that becoming active over the lockdown is a really detrimental thing to your health as well. So again, just come back to us if you've got any questions about anything we're doing. We'll be happy to answer any questions. Thanks, Priscilla.
Thanks, Alison. So that was really helpful. Dudu, over to you. Just a quick update, that'd be great.
Yeah, great. And I'd just like to say thank you to Fizilla and the team for organising this session, to everybody who's attended. And also, Alison, thank you, for those were great messages to get out to everybody. So I am really just reinforcing the messages that Alison has already said. So flu is an important concern for us. It is an important illness. For most people, it's an inconvenience, but particularly for older people or people with underlying conditions, it can cause really serious illness, hospital admissions, and worse. And obviously that is really what we want to avoid. This year, of course, we have the added context of the COVID coronavirus pandemic. And so we are really keen to maximise the uptake of flu immunisation amongst the residents of Enfield. There is an expanded eligibility criteria for free NHS immunisations, and my colleagues from the CCG will explain to you in a moment how the eligibility criteria has expanded. And so really, I'd just like to reinforce Alison's message. Absolutely, if you are contacted by your GP, please do take up the opportunity to have your flu immunisation this year. Even if it's the first year that you've ever done it, please do take it up. We're very much encouraging it, and it is all part of our how we can individually contribute to keeping ourselves, our families, and our communities safe.
Shall I?
Can you do a voiceover, Hector?
Absolutely, yeah.
Can you see it now? Can you see it now?
No.
At the top
No.
of your list.
No. So first of all, sorry everyone for the technical problems we're having, and certainly I'm having some of my camera doesn't seem to be working, so apologies for that. So I think just echoing what colleagues have said already, flu season every year is very, very important, but it seems to be even more important this year with everything else that's going on, in trying to make sure we protect ourselves and our loved ones in our communities. In terms of the groups, I'll just very quickly go over the groups of patients who will be asked initially by the GPs to come forward and get their flu jabs. So in terms of children over the age of 6 months with a long-term health condition, the 2 and 3 year olds, and all children in primary schools, and in this we also increased it to those in the first year of secondary school, so the year 7s. Okay.
Sorry, Hector, can I just interrupt for a second? V, yeah. I think we can still hear your video, so it's kind of crossing against Hector, so we can't see it, but we can hear it. So maybe if you just closed it down, that would be great, and then Hector can carry on. Thank you.
Thank you. Yeah, so that's the children group. Pregnant women have always been offered the flu jab, and it's extremely important to help protect mum and baby as well. So they'll be offered the flu jab during the maternity appointments or with the GP. All over 65s, and any adult patient or any patient really who has a classified medical problem, which is including sort of long-term respiratory diseases such as asthma, which requires an inhaler or has led to hospital admissions, so severe asthma, COPD, chronic obstructive pulmonary disease, emphysema, bronchitis, so chronic heart disease such as heart failure, chronic kidney disease, chronic liver diseases, hepatitis, chronic neurological conditions like Parkinson's or motor neuron disease or multiple sclerosis or cerebral palsy, any patient who has a learning disability, any diabetic, any patient who has a problem with their spleen, so for example if you have sickle cell disease or if your spleen has been removed, and anyone who's had a weakened immune system For example, if they're taking chemotherapy or high-dose steroid tablets, HIV or AIDS, or anyone who's severely obese, so a BMI measurement of over 40. And that's the main group of people, although the list isn't exhaustive. There's obviously a wider list than that as well. That's the sort of general list. And also this year, all healthcare and social care workers as well, and anyone who's classed as a carer should be vaccinated too. The extra groups this year really are the children in year 7, so the first year of secondary school, and those people who are in the shielded COVID list and members of their household. They should also be immunised as well, because they've been deemed to be in that vulnerable group as well. And later on in the year, once we know that we've got enough flu stocks as well, so we're hoping around November, December, that kind of time, we're hoping to also immunise patients who are aged 50 to 64. So that's the aim. But obviously, that last group, the 50 to 64-year-olds, please look out for the advertisements and the texts and the sort of notifications coming from the GP surgeries in the coming months in terms of getting the flu jab for you.
That was helpful, Hetal, and I think it was such a list. We always try and do a Q&A sheet after the event, but it would be helpful perhaps if we can list at least some of those examples. That would be helpful for people to be clearer about, in terms of whether they're eligible, or at least not to panic if they're not, they don't have that kind of condition. So that's great. So thank you for that. So what I think we'll do is, I can already see some questions coming through. Judy's answered one of them, and I know there's already another question around immunisation and do we have to have one in the next year, but let's take them in turn and we can follow up. So I'll kick off if that's okay, and then we can hand over. And I just think whoever's able to answer the questions, just say, I can take that, and come off mute. That would be great. So the first question is asking, and there are quite a few questions around school actually, that will schools be able to offer the flu jab, so the actual injection, as well as the nasal spray? Because I think there is a view that the programme is happening with the nasal spray. So this is about, will they also have the offer of an injection? I don't know who wants to take that.
I can answer that. So hopefully, can everyone hear me? Because I'm having lots of technical issues. Right,
yep.
Excellent. If you can at least hear me, I don't know if you'll be able to see me, but just in terms of school age children for the injectables, at the moment it's only available for those who have a clinical risk for the nasal spray. So at the moment, the procedure is that school service will then refer that child to have it done within general practice. So between now and November, it will only be provided if there is a clinical contraindication. We understand that National, so Public Health England, want to expand providing the injectables for those with a cultural objection to the nasal sprays. And what we're doing is we're waiting on a letter from the National to articulate how we would go about undertaking that. So from our perspective at the moment, it's very clear that if anyone wants an injectable and it's because of a clinical contraindication, then that patient would be referred back to general practice, and general practice would provide that immunisation.
Okay, so Peter, in the meantime, given we know things might take a while and things are progressing quite fast, is the advice that if you can, regardless of your cultural, whether you're vegan, I know there's questions around lactose, vegetarians, etc., that actually it's still worth getting the nasal spray for your child if you can, rather than wait? Or
Fazila, I'll take that if that's okay. Yeah. Yes is the short answer. By far, the most effective form of flu immunisation for a child in the children that we mentioned is the nasal spray. There's no two ways about that. So It's only in the children, when Peter mentioned about those children who have a clinical risk, the children are not tolerant because their immune system is unable to handle that, if you like. So, for example, if a child was having, will be that will be patients in that sort of group. So what we don't want, and is a situation where we're sending mixed messages and confusing messages, and it's very, very clear that the nasal flu spray is by far the most effective form of flu jab for children, and so we don't want to have any sort of delays where possible, because we know by far that the sooner we can immunize as many people, the better everyone will be, not only the child and their family, but also the wider community, because the flu is spread, especially by children, unfortunately. So they sort of act as a reservoir, if you like, for the flu. And so what we want to try and achieve is as many people immunized early on, bearing in mind it takes up to 2 weeks for the flu, whichever way you give it, for it to sort of start to really work. Although having said that, the flu spray works faster than the jab.
So Hetal, thanks for that. Just to clarify again, so what I'm hearing, and I wanted to, because there's lots of important information there.
Sure.
It's important to get it as soon as possible, but it sounds like you're saying the nasal spray is a live vaccine. Is that right?
Yes, absolutely.
And therefore it's more effective, it's better. But if you have a clinical issue, immune issue, etc., that's when maybe the injection would be considered a better option.
Absolutely, and there'll be very few children in that group for obvious reasons. Most children don't have those sort of problems, but if they do, then of course contact the GP, and the GP will be able to administer the flu jab, the injection. Yeah.
So, because the next question, I'll go on to the next question because it's fairly relevant. It says here, my son got bad flu after he had the vaccine last year. Okay. Could this happen again, and what are the side effects?
Okay, so I suppose I'm going to ask in very general terms rather than a specific case, because I think that's the ask of with such a wider audience. So there are lots of myths about the flu and what can happen, and because effectively for most people, so forget putting the children aside, but even with children, when we're giving the flu jab, it evokes an immune response so that the body produces antibodies, but there's no, in the injection certainly, there's no live vaccination in there, so it's impossible for someone to actually get flu from it. But even with the flu spray that we're giving in children, we're giving what we call an attenuated form, which is basically a weakened form, severely weakened, but also it doesn't work at body temperature. It works at the sort of colder temperatures, which is why we give it as a flu form. So it works in the nose. So even if it was to be inhaled and it goes into the lungs, it can't work because it's too hot for the virus to work there. So it's impossible to actually contract flu unless you're a very severely immunosuppressed person. So someone who was on very strong chemotherapy and they got the live vaccination, but they wouldn't be getting that for reasons already spelt out. So you can't catch flu from the flu jab is a short message from that.
That's really helpful because there's a worry.
Zilla, could I just add something to that?
Yes.
I think the other thing to remember in relation to that is obviously we are giving people their flu jabs during flu season. So we know that there are cold and flu viruses starting to circulate, and as we go through the season, they are circulating. So people may well, transmit a flu virus or a cold virus that way, just prior to receiving their flu vaccination. And that's also a perfectly, reasonable sort of explanation why there might be, somebody might receive their flu vaccine, but very you know, within a couple of days, they might have a runny nose or something like that. It's just because they've picked up a virus before they received the vaccine that is coming through.
Yeah, no, that makes perfect sense.
So if I can just add to that as well, sorry to cut in. So you know, what Dee says is absolutely correct, and it's just bad luck there basically, that you know you're already harbouring the flu and then you had the jab, and there's not much we can do about that. However, one really important thing, and something I see in my consulting room all the time, is people feel they've had the flu, and when you speak to them about the symptoms, and they're still able to go to work and school, and they basically didn't have flu because you'd know about it if you'd had the flu. You're literally, as someone who's had the flu before, I can tell you, you're literally feeling you're on death's door. You're stuck in bed. You can't do anything. You're sort of drenching your sheets in sweat, and it's an awful experience. It's not the same as a flu, which is just more making you feel very miserable. This is a very different experience. So most people who feel they've had flu, it's unfortunately something that we use quite interchangeably in our language and in our, you know, sort of the way we speak. But most people haven't had flu. When they've had it, they'll know about it.
Okay, so just a couple of questions coming on the chat that are relevant as we're talking about the nasal spray, and I think there is a question later on that asks if people have a phobia of injections, or they've got learning disability difficulties and they literally cannot have the injection for their own anxiety, would the nasal spray work, particularly if they're teenagers or adults, or is it only if you're, you know, a child?
The short answer, because I know time is short, is it doesn't work so well in other groups outside of children. And I think the thing to do in that situation, because there'll be very few people affected by that sort of dilemma, is to speak to the GP about other ways in which we can try and limit the anxiety or stress so that we can sort of give the flu jab.
Okay, so you're still recommending, ideally, if they somehow, to actually have the injection as opposed to the nasal spray?
Yeah.
In an adult. Okay, that's helpful. Okay, I'm going to carry on. There's some questions coming through the chat, but Judy, you're doing a great job responding, so I'm going to keep going. For people who are shielding or who have mobility issues, their flu jab, so they actually can't get to the surgery, so they're homebound. Who wants to answer that one?
Yeah, I'm happy to again.
Okay,
so at the moment, the picture will be different depending upon your GP at the moment. So at the moment, GPs are starting to get all the flu jabs in. Some have already got them and some haven't. It's unfortunately all down to the way the logistics works in terms of delivery from the pharmaceutical companies. But by the end of this month, I've just actually come off a flu call before this talk, where I've been speaking to various GPs who are looking after this, and we are quite happy that we are expecting deliveries by the end of this month. And what that means is most GPs probably don't want to be advertising about flu clinics fully until they know they've got the flu jabs in stock. Otherwise, you'd have the dilemma of having to rebook patients last minute and things. So we normally, as GPs, try to wait for the flu jab to actually be in our fridge before we start calling patients in. So look out on the GP websites is the first thing, and you'll be able to see when the flus are going to be available. In terms of specific groups, like those who are housebound in the shielded list, so all GP surgeries now, mine included, we've all had to really rethink the way we're going to be doing things this year because of all the COVID restrictions. And so, for example, in my surgery, we've put up a tent, a very big tent, which is outside. So the flu jab is not going to be delivered inside our building. And it's sort of a one-way system in. Patients are being asked to book at specific times and to come with sort of a light t-shirt, which is quite doable at the moment with the lovely weather, so that we can quickly jab, and patients are sort of in and out very quickly. And it's a very efficient system, and it's working very well. We've done it so far with our children, and we're starting with the adult patients now too. And in fact, this Saturday we've taken over a floor of a car park in Enfield, and we're doing sort of drive-by. I was going to say drive-by shooting, but that doesn't sound right, but drive-by jabbing at least, and we're going to be seeing how that works. And other GP surgeries too are going to be doing different things like that. So that's just to sort of provide a sort of a general reassurance. In terms of shielded patients, you know, obviously we're looking at the sort of guidelines at the moment, and at the moment shielded patients don't have to shield in the way they had to before. They are allowed to go out. So if the law now says that you're okay to go to the supermarket with restrictions and sort of, you know, wearing masks and things and taking the precautions, then you should also be able to come out and get your flu jab with all the sort of precautions that have been taken. So it's all been very thoroughly planned out, and so you are safe to have the flu jab if you're in the shielded group. In the GP, I was going to say in the GP surgery, but it may not be actually in the surgery. I should add to that some GP surgeries are still going to be doing it in their surgeries, but they're going to have a very robust system in place to make sure that it's sort of similar to what I've described earlier, so that there's a very COVID friendly way of doing things, to put it in simple terms. For those patients who are truly housebound or very frail, the GP surgeons will be getting in touch with you in due course about how they're going to be making sure that you're kept safe with the flu jabs. I don't want to give details because things are still being worked out at the moment, but there will be something in place. The trouble at the moment is that we have lots of questions and we don't have maybe all the answers because things are evolving and guidance is evolving as well. And so I'm just mindful that I don't want to raise people's expectations or say something which I don't have the full answer to. So I apologize for that, but it is where we are at the moment. The best thing is to try and keep in touch with the GP surgeries. The websites are perhaps the most efficient way of doing so. But of course, if that's a restriction, then just call the surgery and ask to speak to the receptionist who'll be able to give you the latest guidelines. Thank you.
Thanks, Hetal. That was helpful. Dudu, did you want to say something?
Yeah, I just have actually a question for Hetal and Riyadh that has just come up in the chat. For older young people, so those above the year 7 age group,
yeah.
Can pharmacies provide flu jabs for older young people? Or is it only for over?
Not on the NHS. Not on the
not on the NHS, but there's been a kind of stream to say that if people who are not eligible for NHS flu vaccination, they can actually go privately to their pharmacy and book in and pay for a flu jab. Sure. I just wasn't sure whether pharmacies are able to provide private flu jabs to children.
Sure. So, like I said, I've just come off a call where we had various groups there. So one was the pharmacy representative, and what they've said to me just maybe half an hour ago was that at the moment they're working very closely with the GP surgeries to make sure that at this time now we prioritise patients who are in the at-risk groups, so the groups that I mentioned earlier. And that's because the reality is at the moment we have huge ambitions to try and make sure we get as many people in the at-risk and vulnerable groups vaccinated first. And with flu supplies, so just to give a bit of background, it might answer some questions downstream. The way flu jabs are sort of ordered is based on, so for example, what we'll be ordering for next year will be ordered very soon now. So the flu jab, because there's a time it takes to manufacture the jabs. So the jabs that are ready for the season have already been made. And so there's only a limited number of jabs. So clearly we'll have to make sure that we hit the groups who are most vulnerable first, so that we make sure we haven't run out. And then of course, once we know that we're happy with that, we can start moving it out to the other groups to make sure we try and immunize as many people. So at this moment, I would suggest that the pharmacies cannot give it to patients outside of those vulnerable groups.
So Hetal, is that regardless of their age? It's not about the age, it's about the fact that the supplies need to be prioritised for those who are more clinically vulnerable?
Absolutely, yeah.
Okay, I'm hoping that's clear.
What we're trying, so just to make it very clear, what we're trying to achieve is to make sure that those people who are most susceptible to flu, but also the effects of flu, so remember, flu kills. I know we're all very worried about COVID, and rightly so, but the flu kills more people than COVID has every year. So it is something that's serious. It is something which we do try and talk about every year. But certainly this year it seems to be even more worrying because if we were to try and if we were to get a second wave of COVID and there's a bad flu season, it would be an absolute disaster. So we are trying to make sure that we get the flu jab to protect the most vulnerable people first, and then move it from there.
Okay, but then I'm not sure, does that still answer the question around if you're private, so you're not clinically at risk and you're going to Boots or Tesco's, and I believe they have a different supply. If you wanted your child to be vaccinated and you pay the money, is that an option?
No, it shouldn't.
Okay.
It shouldn't be, because, like I said, even though you're going privately, that the flu stocks come from several manufacturers. They're all coming from the same place, basically. So there's a certain pool of flu jabs available, and so whether a GP surgery has ordered it in or a pharmacy has ordered it in, it's still the same place that it's come from originally. And we only have a limited stock at the moment. We are hoping to get more, but obviously there's a lag time with manufacturing and things like that. So at the moment, what we want to make sure we do is that everyone has to be a little bit responsible with this, and everyone has to work together, is to make sure that we immunise those who need it first, and then hopefully we have some over. And I know there's a national nationally the people who look after the sort of ordering and things, that they are trying to get more flu jabs in, but there will obviously be a time lag before that happens.
So Hetal, sorry, I just, so I'm clear as well.
Yeah.
So regardless whether you're a child or an adult, if I'm an adult and I'm not clinically at risk and I have no issue, I'm 40 and very fit and able,
yeah,
I cannot now go into Tesco's and buy and get a flu jab, because technically it's supposed to be prioritised. Is that what I'm hearing?
Absolutely, yeah. And I think so. We all have a sense of, have a responsibility in terms of how we decide to act as well. But the pharmacy shouldn't be offering that to
right. Okay. Well, that is interesting.
Healthy adult. In an ideal world, we'd have 65 million doses of flu ready for everyone. But that's not how it is at the moment. So
okay.
And you can see what's happened, that we've expanded the groups to try and deal with as many people as we can, and that's the right way to move forwards as we try and protect everyone.
So it would be really helpful, to get that list, because again, there's a question here about if you're looking after a disabled child or adult, if you're a carer. I guess if you're still one of those.
Absolutely. I mean, the list should be probably on one of the NHS websites, but I'm sure, Riyadh, if you don't mind forwarding, or Peter, if you don't mind forwarding on that list, and then we can have it published on the Healthwatch. And
yeah, we'll share the list. The eligibility criteria is on the NHS Choices website, so it does provide that.
GP, and it should be on most GP surgery websites as well. But I think someone's put it up there now.
Yeah, Emma's helpfully put it up, so that would be fabulous. So guys, I think this looks like it's a really important place to go, so do look at that, because I think that will give us a lot of our answers. Okay, I'm going to move us on. So it sounds like Hetal, GP practices are going to be creative and looking at where you can have the jab, whether it's the car park, etc. Are there any views to do it even more widely, playgrounds and that kind of thing, or is it very much it's the GP car park or at school?
So we've had a very as to putting my GP hat on, it's been a very interesting few months, really. We're trying to plan for flu this year. Flu season always brings up technical issues, I think, and logistical problems. But this year, clearly, it's a lot more complicated. We've had a very short period of time to try and. It's not as straightforward as just going to a playground and sort of requisitioning it. You have to kind of have a really robust plan in place. And so, for example, in our surgery, we're going to be taking over a floor in one of the commercial car parks there, but there's been a lot of work that's gone behind trying to make sure that that's done in a safe way, and that we have, because what we don't want to do is also create traffic on the road, and there's lots of things to think about, even things like making sure there's adequate lighting and heating and things like that. So we have to think about quite a few things. So it's not as simple as just being able to just sort of pop up a shop, although we have looked at lots of different options as to try and make it as something that can work, but also something that's going to actually achieve what we want to do.
No, that's helpful. I think just people are obviously asking those questions. So, and my understanding again that you'd said in terms of the timing, obviously the supplies are coming in as we speak. So GPs will be contacting their patients as and when they come in,
Yeah,
hopefully during the month?
Absolutely. So hopefully by the end of this month, all the GPs should be having their stocks, and same with the pharmacies as well. So you can go to either place really, but again, wait for the comms to come, the communications to come through from the surgery, because what we don't want to do is inundate lots of surgeries with people phoning about their jabs. They will be coming. There will be lots of advertising. All the normal sort of ways we do that, but just be a little bit patient for that, because I think most surgeries certainly wouldn't want to be calling people in prematurely without knowing 100% we've got the stocks in place.
No, that makes sense. And I guess also there's the GP website. If people have access to online services, then they can check on the GP website.
Absolutely. And just as a small note there is that, a lot of GPs now, we've had to adapt technology very quickly because of COVID, and patients will be used to us now texting and things like that. So, make sure your phone numbers are up to date so that lots of communications will be coming that way. Obviously, if that's not for you, then that's fine. There are other ways as well, but we have to start thinking about how we can try and get as much information to as many people in the most efficient ways. And so I know some people don't like text messages, and that's fine. But the vast majority of people seem to respond quite well with that. But it's only as good as the numbers that you left on the system. So please do update that. And there are lots of apps, NHS apps and things like that, which you can download on your phone. Very quick and easy to set up. And useful for things like requesting your medications, but also booking appointments, but also getting these sort of alerts about, what's available right now.
Okay, thank you.
Can I just come in just to say that if anybody does have primary school age children or in year 7, the consent information for that will be coming out within the next few weeks to schools, or from schools rather. This is provided by Barnet, Enfield and Haringey NHS Trust, and it's provided by our school-aged immunisation team. So it's just a kind of a note to everybody to look out for that if you have school-aged children, or if your family have school-aged children, please do encourage them and get them to look out for those consent forms that should be coming out soon.
Thanks, Dudu. I'm just going to move us on to the next question, which says, will the flu jab protect against the coronavirus as well, or not?
No. Two completely different things. So the very quick and easy answer to that is no. This is a very, very different, even though the real similarities is that they're both respiratory, i.e. inhaled viruses, but they are very, very different. And the flu jab is only going to protect you against the strains of flu for which it was manufactured. It's not going to protect you against other things.
Yeah, and it's interesting because there's a question on that, on the various strains. How many strains are covered? I guess it can't cover every single one that's likely to happen, or?
No. So what happens is every February, the World Health Organization, they're always tracking what flu strains are going out and about. And I'll give you a very quick science lesson if you like. So there are 3 main strains of flu, A, B, and C, keeping it very simple. C is the less important one, but it's A and B, which we normally try and make sure the flu jabs are targeting. But within those A and B, there are literally thousands of different variants of that. So what the World Health Organization do is they try and see they're trying to choose which horse to back, basically, which strain should we be trying to make sure. And they use various modeling techniques and things to try and capture that. And so what you get in the flu jab is a combination of A's and B's, to keep it very simple, to try and target what is predicted based on all this modeling as the most likely offenders for that year. So, for example, for this year, the flu jabs would have been formulated based on that work in sort of February 2020.
Thanks, Hetal. That's helpful. So moving on now, we've already we've kind of said when the flu jab will be available from. Somebody had asked that question. So the question.
So now-ish.
Now-ish, yeah, and basically just wait. Hopefully, if you're within that at-risk group, the GP should be contacting you directly. If you're fit and able, then you just need to wait, full stop. And if you're over 50, and you're still eligible, then it's likely to be towards the end of the year once the vulnerable have been supported. Yeah, is that a summary?
Fantastic, yeah.
Brilliant. Okay, so this is a question here, and I think we have to, so it says here, due to the COVID outbreak, what types of different measurements, but it might be even support, will be provided by surgeries to give flu jabs to patients with learning disabilities? I guess that's you, Hetal, again.
Yeah, that's fine. No, absolutely. So we support all the various groups of patients that come into our surgery, and of course learning disability patients as well. So in my experience, the vast majority of patients who have learning disabilities are still able to get into the surgery, and so it would be as explained before. But of course, if you feel that there are some additional needs required, or some based on the extent of the learning disabilities, it covers quite a wide range of potential problems, then please do also flag that up with the receptionist when you're booking in, so that perhaps more time or whatever can be accommodated. For those patients with very severe learning disabilities, for example, if they're living in a residential home or require a lot of nursing needs, then as we explained earlier about the housebound patients, there'll be probably something very similar happening for that group of people as well. But also, please make sure that those people who are carers, please make sure that you are getting yourself immunised, and please book into the surgery in the normal way, and make sure that the GP surgery has it written in your notes and coded in your notes that you are a carer, so that they know to ask you to have your flu jab via the texts and things like that.
Actually, yeah, that's a good point, because I know just even personally I've asked and been told no, so it's good to know it's changed this year. But actually, it's also a responsibility for carers to register and check that they are registered as a carer on the GP system. Yeah. Okay.
Absolutely. So yeah.
Could I just add a point as well, that all residents of care homes and all care home staff will also be receiving flu immunisation. Just information for those on the call who've got family and friends who may be in residential care.
Okay, yeah, that's helpful to know, actually, because we know they're a really at-risk group, aren't they? So it's good that they're obviously getting the same support. So the next question I think we've actually already covered, because it's basically how will people be notified and how they can obtain their flu jab. So again, just to summarise, if you're within the at-risk group, you should just wait to be contacted by your GP. And then they will give you further details. There's information on the website. If you're not at risk but you're over 50, you just need to wait your turn till towards the end of the year. And otherwise, yeah, be prioritising the clinically vulnerable. Okay, I've just seen that it's Lindsay to everyone. I'm just interested. Just Googled flu jabs and Lloyd's Pharmacy advertising private flu jabs of £12.99. This goes against what was said earlier. I don't know if anybody or Riyadh or anybody wants to make a comment on that, or if not, we can find out further. So,
I don't know the answer to that, but Peter.
Yeah, so obviously they are entitled to provide private sessions. What came out last week was an updated framework for community pharmacy, where it was very explicit that it really needed to focus its NHS stock to certain cohorts, as the expectation is with general practice. So while they might offer it, all of their workload will be going into delivering it, particularly for the over 65 cohorts, because we know that's the vaccine they're being delivered as we speak.
So exactly, and I think it also goes down to a sense of personal responsibility as well. Is that, look, we've got a restricted supply at the moment, and supplies are trickling in. But if you are not in one of those vulnerable groups, then please try and just wait for a bit and try and help the effort to make sure that those people who are truly vulnerable and need it sooner can get that. So there's two sides to this, as always.
Okay, I'm just looking at the chat, and I think it's important. So there's a question around employers giving domiciliary care workers the flu jab. So how would the employer know how to do that? Would the CCG be contacting them? Are employees supposed to know that they should be accessing it somehow? How does that work? Sorry, it's been a...
So,
Yes.
Get back to you. Oh, sorry, Dudu.
I was under the impression that organisations employing domiciliary care workers would be providing or organising their flu jabs. Peter, I don't know whether, do you have any different understanding?
No, I have the same understanding. So we've already had conversations with North Mid, who are obviously a large provider, the CCGs. So it's a duty for employers to offer the jabs for certain roles and functions within organisations. So
do you know how employing organisations can go about doing that, or do you have a contact for people to follow up if they are employers?
Normally they go through their occupational health services. I know from CCG, we normally approach a local pharmacy who provides it on a private arrangement. So we do, and then North Mid will have their own arrangement because they're such a large organisation, they'll probably be able to provide that internally.
Okay.
And then within general practice, there has been SLAs put in place where they can administer it to their own staff as well, and it's a similar set of arrangement for community pharmacies. But it's done on the employer pays for that vaccine to be administered.
I see. I can just see in the chat that there is a question from somebody who says, I am an employing organisation of domiciliary care workers. No, that's not correct. No, this is incorrect. In the past, our staff have had the NHS provided the jabs.
Hi, can we maybe then, I think this was one just to take offline, and when we have a clear response, we can then feed that back. We'll include that in the Q&A. We've got the chat, so we can also go directly back to the individual and give them that response. Is that okay?
Absolutely fine. Yes, of course it is.
Brilliant. Fabulous. Okay, Alison, I don't know if you want to join in and ask some questions, or did you want for me to carry on? How do you want to?
Is that if you're okay to carry on? I'm trying to deal with something else as well at the same time.
Okay, no, that's fine. Okay, I shall carry on. So moving on with the questions. This is one where we're concerned obviously about your GPs, because it's saying what help is being offered to GPs to help with the expected high number of people wanting the flu jabs. So maybe the EG one or head talk?
Sure. Yeah, absolutely. So all GP surgeries have a PPG, a patient participation group, which helps support us and adds a bit of a bridge, if you like, between what's happening with the patients and their thoughts and views on things and what we are trying to provide as a provider, if you like. Certainly, so we started our flu clinic in this tent that I put up a few weekends ago. In our car park, and we were very lucky that we had some of our patients volunteering as marshals to help sort of direct people into the appropriate place. And as I said earlier, this Saturday when we're doing our flu clinic in this car park, we have again got a small army of volunteers who are who are really really supporting the community and really doing a great job of trying to help surgeries at this very difficult time. So hats off to these people. They're sort of silent heroes. They don't get any mention, unfortunately, by the normal channels. But they're doing a fantastic job and helping us to sort of keep things moving really and making things from an operational point of view very smooth. So I thank you for that. And GPs are working very hard. The surgeries are working very hard to make sure that we can have a very good flu season in the sense of delivering the vaccinations in a safe way, bearing in mind all the restrictions of COVID and things, but also a very efficient way, because we also have to, like I said earlier, we have to think about, we don't want to have backlogs of queues of people going onto the street or or traffic building up and that sort of thing as well, because that would cause other problems, especially for the wider community. So we're very sensitive about that. So we've lots of planning that's gone into this, and I think the best support is really just to try, where possible, not to call in where things can be answered on things like websites, etc., if that's possible.
Hi, thanks. That's great. The next question I think we've covered. So my adult son has learning difficulties and is scared of needles. What are the options to help him have this, as historically we've been unable to give him the jab? So for example, he's had to have blood tests when he's been under anaesthetic. So I guess this is somebody who's clearly got, behaviour concerns, anxiety concerns. So is there a top tip on that one?
It's a very complicated area, and I think with this sort of forum, it's very difficult to answer. But there are, because it depends on what exactly is going on with this patient and what the needs and what's been tried before. But in broad terms, there are sort of medications that can sometimes be provided to help sort of calm a patient down. It's not something we like to do, and not something we would definitely, something we wouldn't do lightly. But we have to sort of weigh out the sort of pros and cons as with most decisions, and try and come up with the best solution. Sort of in a safe and coordinated way. So I think it'd be worth in this case to contact the surgery directly for what sounds like a more complicated a way of trying to sort it out.
Yeah. I guess the message that I'm hearing from you is, even though it's going to be difficult, actually this year it's worth pursuing and trying to work a way round it, as opposed to just avoid the issue and not bother.
Absolutely, yeah, absolutely, and I can say quite confidently that my GPs, as a group, will work very hard to try and make sure we we'll go that extra step to make sure that we try and make sure that everyone is kept as safe as possible. So please don't leave it late, and like I say, it's one of those scenarios where if you can try and communicate with the surgery earlier, then something can be planned. Yeah. And if there's other checks and things that need to be done for this patient as well, or blood tests that are needed, then it might be something that can be coordinated. But like I said, I don't want to overpromise what can be done. It all depends.
No. But I think the message is, let's try and work it through rather than not bother. In years past, probably, I guess these people may not have bothered. Okay, I'm just going to move us on. So will there be I think we covered this slightly. Will there be an alternative flu vaccine for children which doesn't contain pork, which I think is the porcine element in the nasal spray?
So we've kind of covered this before, but just sort of the broad points is there are, but they're not as good. They're definitely not the first thing that we'd want to give to children, based on them not being as effective and working for as long. And they take longer as well to work as well. So there's all these problems, and the whole it's just a shame that the porcine agent is the only agent that seems to work. I know manufacturers have tried something like 40 odd other agents. The porcine gelatin is used there to stabilize the flu vaccine, if you like, within the preparation. And they've tried lots and lots of other agents, but nothing else seems to do the job as well as this. And that's the reason why it's used in this vaccination, which is a real shame, because it then obviously creates some of these cultural barriers for certain groups of our community, which is a real shame. But it is what it is. So there are alternatives. They're not as effective, and certainly they're not available at the moment. And I think it was Peter who said earlier on that we're hoping, once we receive this third letter from NHS England, about how we might cross that bridge. But I would urge parents, do not delay if possible for this, because there may not be any extra stocks available, and that's a real concern. And also, I wouldn't want people to delay getting the immunisation earlier if possible. I understand it's a very difficult and sensitive area, but it's about trying to protect our communities as well, as best possible. So I really do hope people will still, where possible, get the flu jab done, but it does at the end of the day come to a personal decision on that.
Thanks, Hetal. And I just noted on the chat as well from MDAD, who's kind of part of the Equalities team, has said the porcine is a highly processed agent. used in vaccines. So, you know.
Hi, it's another MDAD. I work for the CCG, and we've sort of covered this within our groups and we've sort of looked into the porcine element about it, and it's a highly processed agent used in the manufacture. And I think in regards to sort of religious and cultural groups, the message is essentially, because we reached out to sort of the Muslim Council of Britain and other faith groups and vegan societies, etc. And essential is that sanctity of life is of paramount importance, and where there isn't an alternative, it's up to you to decide if you take it or not. But I think we need to remember is the sort of looking after sanctity of life, and that's what the viewpoints are. But that's sort of clarified things.
Okay, thanks. Yeah, and I guess it's also, we talk about cultural, but it's also vegetarians, but as an aside. But yeah, no, thanks, Samdad, for that. That's useful. Okay, so the message is it's really important to get the vaccine, however you do it. I think that's really important, really clear message. I'm going to carry on with the questions now. I know we've got the last kind of 10-15 minutes. Here the question from somebody who's deaf. It says, how will those who are deaf and cannot read get information or be able to contact their GP to get their flu vaccine? And I know that has been highlighted because of all the, we've been talking about online and websites, etc. And I guess that's a real issue for people who are deaf, and if they cannot read and don't have access to online, how is that going to work?
I mean, I think that's the same for any communication with a GP surgery. It's not just specifically for flu jabs. How does someone who has these sort of needs contact the surgery? Yeah. I know certainly in our surgery we have various ways of trying to. I mean, you can extend this also to people who have language barriers and things like that as well. And so we do have in surgeries ways to try and help with communication. So, for example, for language, for example, we have language line. We have various technology to try and help us as well. If you're not able to, if you're deaf and if you're not able to speak and also you're profoundly deaf, then obviously the phone is not really an option. It may be we do have sort of sign interpreters sort of facility available too, but that would require having to obviously go into the surgery, I would have thought. So it might be that's something that you do in that sort of case. But surgeries do have sort of protocols to try and help sort of deal with patients in these sort of groups.
Thanks, Hetal. So really, it might be that actually on these occasions, the individual would it be better for them to actually attend the surgery, and at least then I guess if they're signing, somebody's going to realise that they'll need an interpreter, and then maybe book an appointment.
Absolutely, yeah, exactly, and that goes, like I said, the scope of that is beyond flu. That's a generic sort of thing. But just to add to that is, again, all surgeries at the moment are still working within guidelines, which is not to have unnecessary footfall onto the surgery. So call first if you're not sure. And there's various other ways, lots of technology now in ways that you can contact the surgery as well. So if you look on the websites, there's ways you can ask simple questions like, if that doesn't help in this scenario if you're not able, although if you're able to type, then that should be absolutely fine. But communicate with the surgery early on, as we can see, we can try and help with these sort of situations. Yeah.
Okay. And I just sorry, I was just looking at the chat, but I think and somebody said, yeah, maybe ask a buddy. I know that's why EDA often get calls or contact to help. So it's seeing if somebody can help you make those connections. But I think the GP surgeries are also looking at an interpreter app as well, which would be really helpful. Okay, I'm going to move us on in terms of our questions. So actually, this is a similar one. Currently, everything is online or phone. To speak to the GP, how would GPs contact patients if they don't have a computer or mobile phone for receiving text messages?
Okay, yeah. So there are patients who don't have that sort of means of sort of accessing technology. So so if you do have a mobile phone with you can receive information on there. by text, but also by accessing the website. But if you don't have access to those sort of things, then sort of the just more traditional ways, which is probably calling into the surgery and asking for assistance, is probably the best next step.
Does it issue letters still? If you just like the good old-fashioned way, where you'd actually just write to somebody's home address saying that you need? We
do on occasion, but the problem with COVID is that we don't particularly want to be sending letters, because that's a potential route of transmission. So you've got all these sort of conundrums that you have to try and sort of navigate through. So I think in this situation, this would be certainly in my practice, we have lots of patients who are in this group who can't access technology.
Yeah.
Quite often they'll have a family member who does the sort of booking the appointments and things like that. So that solves the problem for them if that works for them and they're happy with that. But if not, then ringing into the surgery and speaking to the doctor in the more traditional way is still that.
Okay, so ideally get a buddy, or if you can, telephone in, or I guess that's where the likes of the voluntary sector, Age UK and other organisations then might be able to help if people don't have friends or family to assist and they're not online.
Absolutely, it's horses for courses. It's what works for you and what works for your needs, and I know it can be quite difficult and challenging at times navigating help.
Exactly.
Even beyond healthcare, in all forms. And we all have to do what we have to do, and we rely on our friends, neighbours, family, etc., where we can. But that's not sometimes appropriate. If there's if you're ringing up about a personal health problem that you don't want your family to know about, in which case contact the surgery yourself where possible. But if that's still not a possibility, there are other advocates as well, and I'm sure Age UK, etc., and Healthwatch are there to help with that. I know in Enfield we also have the over 50s as well. So there are lots of avenues for help. Sometimes it's a bit muddling, isn't it? There's perhaps too much option, and it's difficult to know who's the right person. But most places are very good at navigating and sort of navigating, at signposting where to go to if that's not the right place. And I know we're quite good at doing that in Enfield. So don't feel it's too much of a bother. Ask for help. We're not sure, and answers will be forthcoming.
I think that's the key thing, isn't it, Heto, is ask for help. Don't just think it will go away or not worry about it. Because I say, I think maybe in previous years, whether it's the flu vaccine, etc., you might have not made the effort. But I think what we're saying is it's really important to get it, particularly this year. And on that note, there's a question around how long the immunity lasts. And I think I remembered on the chat, somebody had said, if you have the flu vaccine this year, does it mean then you have to have it again the following year? So it's kind of a double. How long does it last?
Absolutely. So usually the flu jab lasts several months. So the way it works is that it builds up in the system. It takes normally a couple of weeks to get to its sort of peak, and then everyone's a little bit different, but you're looking at several months of cover. So hopefully you should be covered during the peak season, which is between sort of September, January, February, that sort of time period, and then it sort of wanes off. But it's not about, remember what I said earlier about the flu jab, the flu viruses change very, very quickly. And so what works for this year may not work for next year, because the strain of flu will have changed most likely in that time. So even if it was to give you a full 12 months, which it doesn't, but even if it does, it will be almost no good. It'll be no good me giving you last year's flu jab for this year as an example, because it's probably a completely different strain. So it's one of those things that we have to constantly work on and try and make sure we have the most up-to-date version of the flu that's relevant for this season. So it is important you do this every year, and certainly the reason why it's especially more important this year is because of all the other things going on. But actually the message for flu jabs is to get it done every year, because flu kills lots more people than COVID probably will, and that's every year. So please don't take it for granted.
Okay, thank you. The last question now, and then we'll wrap up. And again, this is a generic one, so you if you give us a generic answer. But somebody's asked, if someone has a relative with a mental disability, and I guess that's either in a hospital or a care home, it says, does the hospital or care home have the right to give the flu jab without contacting the family for consent?
Okay, so this again, it's a bit of a complicated question, I think, and it'll probably have a very complicated answer, so apologies in advance. So it all depends on the individual circumstance. So in very, very broad sort of talk, if you like. So with capacity, so, you know, if someone who doesn't have any sort of capacity issues, they'll sort of, you know, roll their sleeve up, we give them the jab, that's sort of implied consent. Where there's problems or you know, issues like this where they may not have the ability to give that, it all depends on what's happened prior. So the patient, for example, in this case, may have left, you know, either an advocate or some express wishes to say, I want this, I don't want this, you know, sort of a direction for people to follow. So there might be, and that will be in a legal format. Where that hasn't been done, or there's no advocate, then obviously clinicians are, in a care home setting, the nurse or whoever the person looking after you has to then try and decide what's in the best interest. Now, as a doctor, when I go and see a patient in that sort of scenario, you know, I will do my best to try and contact any sort of family members or advocates or anyone who's a sort of a next of kin, that kind of person who would be able to then, you know, sort of help me in making that decision. Where that person isn't there, or there's no family, or, you know, someone is truly on their own, then I'll make a decision which is in the best interest of the patient. And that can be on a number of things, you know, depends on the issue. In terms of flu jab, if I feel that this patient is best served because they're in a vulnerable group, which it sounds like from the example you're given that they are, then it's probably in their best interest to have the flu jab, and so therefore I'd administer it. And I'd try my best to explain it to the patient and do it in a very, you know, sort of kind and sensitive manner, making sure that there's some nurses around who the patient knows. So it's done in as kind a way as possible. Again, that's a very extreme example because most patients are not requiring that sort of requiring so much of their sort of wishes not to be taken into account. But we try our best, and it all depends on the circumstances.
Yeah, and I guess if somebody has capacity, then that would be up to them. If they don't have capacity, then normally there would have been a legal route that the family would have gone down to get consent. So
yeah, or sometimes even patients have things like living wills and things. There's all sorts of legal sort of safeguards in place for this. But ultimately, the sort of example, I think what you were trying to ask in the question, or what I'm reading in between the lines, is if none of those things exist, then yes, doctors will, as with any form of treatment, make the best decision for their patient. And that's something which we are in a very privileged position to be in, and we don't take for granted at all.
No, and so you would try and involve the family, or
yes, of course,
and I think that's probably where they're coming from, is that you would expect some kind of dialogue or conversation. So I think probably that's the key. Yeah. Okay, thank you very much, Hetal, and Dudu, Riyadh, Alison, Peter. I'm just conscious of our time, so I'm hoping that you all found this session really helpful and useful. I know I did personally. It's answered a lot of questions I had in my own mind. I think the key message is it's safe to get the vaccine. Actually, this year, you really, really need to have the vaccine to help everyone and safeguard those vulnerable. The priority will be those who are on the vulnerable list. And then the over 50s, if there's sufficient towards the end of the year, and it would still be worth having because it does last a few months into kind of March, April time. So yeah, really helpful messages. Thank you. I just wanted to get in before I go, and I'll pass on to Dudu, is that our flu survey. So Emma did put it at the beginning, and I think she's repeated it, but on the joining instructions, I think it'd be really interesting if everyone that's on the call could fill in that flu survey, because I think that will really help inform public health, CCG, you know, GPs, in terms of how we can really make sure we're supporting the public. Dudu, I'll hand over.
Yeah, I know that we're right at the end of the session, but there's just been a really useful comment that's popped up in the chat. And I just thought it would be useful to take this opportunity to answer it, because I'm sure that it's something that everybody will find useful. It says, I don't know, so what's the prime difference between flu and COVID? And when should the whole family self-isolate? It's very confusing. And yes, it is very confusing. Essentially, COVID, the flu and COVID are different viruses. However, some of the symptoms are similar, and I'm sure that Hetal can sort of comment on that. Essentially, in terms of the self-isolation guidance for COVID, if you or any of your family members, people that you live with, have got a high temperature, which is over sort of 38 degrees, something like that, so more than 37.5, which is the normal temperature. So if you have a high temperature, if you have a new and continuous cough, and if you have a change to your sense of taste or smell, if you have any one of those 3 symptoms, then the government is advising that the individual who is poorly self-isolates for 10 days, and that the household members, so anybody who that person lives with, self-isolates for 14 days. Whilst you are self-isolating, at the outset of anybody's symptoms, you should seek out a test. And if that test comes back negative, everybody can stop self-isolating. Obviously, if it comes back and it's positive, then you continue with your self-isolation for the 10 days for the person who was poorly, and the 14 days for all the people that that person lives with. Hetal, I don't know whether you want to say anything more about the difference between flu and COVID.
So just to clarify, so I know we don't want to talk about coronavirus and we're trying to keep it to flu, but because it's been brought up, just to clarify a few things. So the high temperature is, the guidelines previously were anything above 37.8. That's now been removed to if you feel very hot, because it takes into account that patients don't always have thermometers and things. It's a new continuous cough. That's really a real sort of cough that's going on and on. That's and anosmia, which is loss of change of sense of smell or taste. Now, I think what the question is really asking is how do you differentiate flu with coronavirus? And the answer is, the real truth is, it is difficult. There are some differentiators, but obviously flu is by its nature quite a sort of a devious thing. It's really has some sort of constellation of symptoms which are quite murky. But with flu, typically you have, like I described earlier, from personal experience, you are literally stuck in bed. You are aching all over. You're drenching the sheets, and you're feeling very lousy and things. And it is quite different to those symptoms I described about COVID just now, about this sort of the dry, continuous cough, and the loss of taste and smell. Although you may have some of that as well with flu-like symptoms. So it is difficult. And I think at the moment, the sensible thing to do is, if you do have those, is you don't really know, without making it very academic, you don't really know if it's one or the other. Mm-hmm. But at the moment, it's COVID first until proven otherwise. That's pretty much the way we've all been practicing for the past, since March. It's if you have those constellation of symptoms, then we really need to take it seriously, because if we don't, and we sort of say, oh, it's just this, so it's just that, then that's how we get transmission. And certainly in Enfield, we've seen the numbers really start to increase in the past week or so. So I think we do need to take it seriously, okay? And as you just rightfully said, you can go onto the government website. If you quite literally just type in COVID into Google or whatever search engine you normally use, you will be able to pretty quickly get straight to the site and request that test. And of course, if you have a negative test, then great, it's not COVID, and sort of carry on with sort of normal advice. It is going to be a difficult few months in front of us, because it's very difficult to differentiate COVID with flu and other sort of colds and coughs and all the sort of normal winter bugs that we all get. And we're all learning as we go along. So I think let's all be very sensible about it. Carry on with all the messages coming from the government. So, hand washing, covering our mouths when we're going out, and taking all these sort of precautions where possible. But obviously, we also want to try and balance that with getting back to some kind of normal as well, whatever that might look like for. We're obviously talking on this sort of forum, which is a great example of how everything has changed. But we have to try and strike that balance and keep everyone safe, but also not also lose a sense of us as human beings and us wanting to do the things that human beings want to do. So it's, life is all about balance, and this is what I would say to any patient that comes to me and speaks to me about how do I handle this. And it is tough. There's no one has all their answers. I'm not going to sit here and try and pretend that I do because I don't. But let's all be very sensible about it and try and work our way through it. Take all the precautions where possible, and hopefully we will have we'll come out of it okay. I'm not sure if there's anything else I should add really, but I'd say that there are crossovers. Oh, there was one other thing: is please keep your medical cupboards at home stocked up with things like paracetamol and that sort of thing, and for the children as well, because as every year. You will still be getting those kind of things. It's just winter, unfortunately. It comes every year, and it comes as a surprise, it seems, but it does come every year. But if you do get the symptoms like shortness of breath, and particularly if there's breathing difficulties, then obviously let's think of it being potentially COVID. And if it's the sort of breathing difficulty that's stopping you doing things, and i.e. something a bit more serious than just a little bit of shortness of breath, then obviously get in touch with a doctor. Or 111.
Thanks, Hetal. I think it was worth covering that. I think it's really important. Actually, just on that point, I had one question around that: is a runny nose. Would you get a runny nose with COVID?
You can do. Yeah, I mean, you can do. It's probably not the main symptom you get with it. And remember, there's nothing stopping, just to add to the confusion, which I apologise for, there's nothing stopping you having all three at the same time or a combination. Of
course,
and that makes it very difficult. How do you, unfortunately, we don't live in literal bubbles, so we can't unfortunately do that. And none of us really would want to either, I think. But it's about trying to be sensible and thinking, do I have the main symptoms of COVID, the breathing difficulty, the cough, and the smell and taste? You may have other bits of other things as well, but it's very, very difficult. And thank you for that last question.
Yeah, sorry, it just occurred.
No, that's absolutely fine. And this is the sort of thing that we're trying to navigate through in our practice as well. We get all these sort of very challenging. It's not challenging. That's the wrong word. Very, very. There are a lot of unknowns out there, and that's the reality of it, and we're all trying to figure it out together. But I think if we can broadly follow the advice and take sensible precautions and use our common sense, and I think that normally is enough for us to get through things.
Brilliant. And I think on that note, I think it's about being sensible, stay safe, get your flu vaccine however you can.
As soon as possible.
As soon as possible, as soon as the vaccines are in, of course. So don't inundate the GP with questions, but look at their website. And if you're in the vulnerable group, wait to be contacted by the GP. But I am assuming if you've not heard kind of during September and you feel that you are part of that vulnerable group, then we should be contacting the GP. If by October, or should we have all, is it going to be that we'll even be contacted in October?
Sorry, if you're in the 50 to 64 group?
No, if you're in the vulnerable at risk group.
So I think I had a bit of interference in the connection.
Sorry, it's just about at what point do we worry and we should be contacting the GP? If you're at risk, you're in the vulnerable group, so be contacted in September.
Yeah, where possible, keep a lookout at the GP surgery website. That's the easiest way to find out the up-to-date information, because that's where everything is going to be live and up-to-date. I think if we're getting into the first week of October and there's nothing on there at all, then certainly contact the surgery. If there's no information. But if the information is saying something like, look, we're still waiting for the jabs, then just bear with that. But I think if we're getting towards the end of the first week of October, then it wouldn't be unreasonable But by that time, hopefully, we also would be trying to work out what's going on there. But from my experience as a GP, we are starting to get the jabs in, and they will be trickling in over the next couple of weeks. So just bear with that, and let's not have a sort of panic about it, and let's just be a little bit patient and wait for them to come through. Yeah.
Brilliant. Okay, on that lovely note, thank you everyone. Thank you all for listening and bearing with us. I'm hoping that you found this session really useful and informative. Do fill in the survey and the evaluation. And I wish you all, it's going to be my last call at Healthwatch, as some of you might know. So I wish you all a very safe safe and calm, but kind of normal. Back to your point, Hetal, trying to keep some balance of normality in your lives, and wishing you all the best. So take care, everyone, and bye-bye.
Thank you. Take care, everyone.
Bye.
Thank you, everybody.
Thanks, everyone. Riyadh, Peter, Hetal, and Alison.